Patient comes in with a chronic history of pain, stiffness, and swelling of her hands, feet, and knees with daily fatigue. There is symmetric swelling, tenderness, and restricted range of motion involving the wrists, ankles, forefeet, and knees. Which of the following is most likely to be the earliest finding during the development of this patient's condition? Now, this patient is presenting with signs of rheumatoid arthritis with the history of pain, stiffness, swelling of the hands, as well as the symmetricity of the symptoms are all characteristic for rheumatoid arthritis. Now, what is going to occur in the pathogenesis of rheumatoid arthritis? Now, let's start off by drawing the bone and kind of visually seeing what is going to happen. Now, here is the bone, and on top of the bones, we have the articular cartilage that is going to be sitting on top of it. Here we have the joint capsule, and lining the joint capsule, we have the synovium. Let's draw the synovium in blue. Now, the pathogenesis of rheumatoid arthritis is going to begin when T lymphocytes react against the rheumatoid antigen. Now, T cells are going to be releasing cytokines, and these cytokines are then going to cause inflammation of the synovium. In return, we're going to get synovial hyperplasia, and we're going to get an increase in metabolism in this area. Now, with this, we're going to consume up a lot of oxygen, which leads to hypoxia, and we're also going to release something called vascular endothelial growth factor, or VEGF. Now, VEGF is going to be important in new vessel formation. Now we're forming new vessels in this area. And let's draw the new vessel formation in pink. Now, these vessels are now going to be bringing in nutrients, and these nutrients are going to be important in growing this granulation tissue that we're building. So now with this new vessel formation, we're able to grow out the granulation tissue that has been building up. And over time, this granulation tissue, because it contains myofibroblasts, which have contractile function, can cause effusion of the bones, which is called ankylosis. It can cause the movement of joints in different directions. And over time, as it grows, it can even damage the articular cartilage and get to the bone and can even cause bone erosion. So to answer the question, the earliest development that is going to occur given the following options is going to be synovial neovascularization. Remember, synovial neovascularization is going to be really important in the rheumatoid pannus formation, so this granulation tissue that I have formed. And with this growth of this granulation tissue, we're going to damage the articular cartilage, and over time, it can cause all sorts of problems. And over time, it can even erode the bone. So answer choice P is going to be a side effect that is going to happen later on. Answer choice A is fibrillation of articular cartilage. Fibrillation of articular cartilage occurs in osteoarthritis. Remember, in osteoarthritis, we're going to get mechanical damage to the articular cartilage. That's it for today. I'll see you guys tomorrow.